Good afternoon, everyone. Thank you so much for joining us. This is the Delta Research and Educational Foundation Chicago seminar for today, March 24th. As you all know or may not know, this is a generation that sits right in the middle of having to care for parents and children. When you look statistically, there are 43.5 million caregivers in the United States. 34.2 of those are uncompensated in terms of pay, and 15.7 million of those are for loved ones that suffer from dementia. And when we look at race and ethnicity, the highest proportion of caregivers are those of the African American or Black community at 24.3. But while we're here today, the statistics are astounding. 14.5% of caregivers have more than 14 days of unhealthy living related to mental health. 17.6% report physical compromise of their health, and 36.7% have insufficient sleep, that is less than 7 hours of sleep per night. And so our goal today is to really identify self-care strategies for those that are caregivers. Perhaps you are a caregiver and you understand, or you know a caregiver and you can provide these self-care guides for them. So that is our goal for today. My name is Yvonne Collins. I am the Chicago coordinator for the Delta Research and Educational Foundation All of Us campaign. This is our core team. This is the team that ensures that we fulfill our responsibilities to the National Institute of Health for this particular project. This slide highlights the 12 cities that are doing the same work that we're doing today. We go coast to coast, really educating the community on various health aspects. The Delta Research and Educational Foundation was established in 1967. It's a nonprofit organization really focused on supporting African American women and their families. The campaign objectives are simple. We want to create awareness. We want to encourage health and wellness, and we want to focus on the education of the African American community. When we look at awareness, we understand wholeheartedly that you cannot make an impact on your own health if you don't understand it. We understand wholeheartedly that women sit at the core of many families. And so the more we educate women, the more we can educate their families and hopefully more educate the communities of those around them. This is a little bit about the work that we've done to date.
In 1967, Delta Sigma Theta Sorority Incorporated established the Delta Research and Educational Foundation as a public charity supporting scholastic achievement, public service programs, and research initiatives focused upon African American women and their families. Today, DREF remains strong, vibrant, and poised to meet 21st century challenges with the same unwavering spirit and dedication the sorority originally envisioned. The charge to realize social and economic equality for future generations of African American women continues as the guiding principle. Since 2017, DREF has received funding from the National Institutes of Health to continue its role as a national community engagement partner to promote the All of Us research program through a community awareness campaign that informs African Americans and minorities about the importance of understanding and participating in biomedical research. The National Health Initiative, conducted by the Delta Research and Educational Foundation in collaboration with Delta Sigma Theta Sorority Incorporated and the National Council of Negro Women, is entitled Research Matters: Creating Possibilities to Achieve Health and Wellness for All of Us. The objectives are to engage, educate, and ultimately enroll African Americans in the National Institutes of Health All of Us 1 in a Million campaign, a national database primarily comprised of diverse and traditionally underrepresented populations. The mission of the All of Us research program is simple. It is to speed up health research and medical breakthroughs by asking 1 million people to lead the way to provide the types of information that can help create individualized prevention, treatment, and care for all of us. The All of Us research program is a part of the Precision Medicine Initiative created during President Obama's administration. Precision medicine is healthcare that is based on you as an individual. It takes into account factors like where you live, what you do, and your family health history. Precision medicine's goal is to be able to tell people the best ways to stay healthy. If someone does get sick, precision medicine may help healthcare teams find the treatment that will work best. This will help give healthcare providers the information they need to make tailored recommendations relevant to people of different backgrounds, ages, or geographic regions. African Americans continue to have some of the highest incidence, prevalence, and mortality rates from chronic diseases such as cardiovascular disease, diabetes, obesity, hypertension, mental health, and HIV/AIDS. Yet we comprise only 5% of clinical trials participants in America. Our focus and objective is to create awareness about how research matters in closing the health disparities gap. DREF seeks the assistance of national organizations, local chapters, sections, community leaders, and organizations to make the All of Us research program a successful endeavor. The influence, leadership, and participation of the aforementioned groups are needed to assist in promoting this groundbreaking opportunity. Individuals, groups, and organizations are welcome to assist with conducting and/or identifying outreach activities. Training, materials, and monetary resources may be available to support groups and organizations with approved collaborations. Please send an email of interest to researchmatters@deltafoundation.net outlining upcoming activities and events in which the All of Us research program can be included. For more information, please visit www.joinallofus.org/DREF.
So as part of the NIH All of Us research program, our goal, just in case you missed it from the video, is to gather 1 million diverse participants. That is African Americans, that is Asians, that is the Latinx and Hispanic population, that's the LGBTQIA, and our seniors. And those are populations often that have been forgotten in research. And it's going to be a longitudinal study.
So
This is
tonight
why
I'm
it's
launching a
important.
new precision medicine initiative to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to the personalized information we need to keep ourselves and our families healthier.
And so you may ask, what is precision medicine? Precision medicine is an emerging approach to treat disease and prevention that takes into account sometimes things that we don't think about, how your lifestyle matters, how your socioeconomic matters, how your environment and your biology matter to not only the diagnosis of diseases, but also the treatment of diseases. And ultimately, what we're trying to do is use that in the prevention of diseases. It's really a radical shift in how we care for patients and the care that our communities receive. When we think very commonly about diseases that you hear about each and every day, cancer, high blood pressure, diabetes, asthma, there have not been until recently very specific approaches about how those diseases are treated based on an individualized approach. And we're hoping to improve that also with this study. These are some of the questions this resource may answer as we build that database. How do we prevent chronic pain that affects more than 100 million people in the United States? How do we slow down or even potentially stop various kinds of dementia? Can we develop pain medicine that's not addictive as we look at the opioid epidemic that we are currently in? How do we develop better treatments for diabetes, potentially even preventing diabetes? How do we also help researchers develop cures, especially for cancer, that work the first time so we don't have recurrent disease? And how do we begin to develop sustainable interventions when we talk about health equity? There are many more, and we've seen over the years of the project thus far, there have been 3,500 trials and questions that have been answered with our database. The innovative aspects of this program is that it's diverse. Again, 1 million participants is our goal. We want people from different demographic regions, different geographic regions, different medical problems, those underrepresented minorities that I talked about. We're looking to collect clinical information, but also environmental information, genetic information, socioeconomics. And the focus is really looking at our participants as partners, and that is how we run the program, how we transmit data related to the program, how we get information back to all of our participants, and really creating a broad, accessible database, not only for researchers, but also for the public when they're trying to do research. So that's our goal with this program. And we'll close here as we look at this last video.
My name is Janelle Johnson. I'm a biologist in the Laboratory of Neurogenetics for the National Institute on Aging within the National Institutes of Health.
Dr. Janelle Johnson has long had an interest in neuroscience, especially in neurodegenerative diseases.
My focus is on the genetics of neuromuscular diseases, in particular ALS, but I also study neurodegenerative diseases such as Alzheimer's and Parkinson's disease.
Developing treatments for these diseases, treatments that are geared to the individual person, is also one of Dr. Johnson's goals.
Research has advanced to the point where personalized medicine has become a reality. And when I say personalized medicine, I mean that specific traits that you might have are more easily targeted by particular drugs. As researchers, we can target those drugs and find the best possible solutions for your diseases.
To find these solutions, scientists need to conduct clinical trials, research studies with volunteers, to see which treatments are safe and effective, and for whom.
If African Americans participate in research studies, they have the opportunity to treat or ultimately cure diseases. If not, we won't be sure if the current studies will apply to them.
Dr. Johnson says that more African Americans are needed for these studies, but there is sometimes reluctance to participate in clinical trials.
African Americans are often fearful of participating in clinical trials, and I think this largely has to do with the Tuskegee syphilis study, which lasted for about 40 years, so a lot of people were impacted by that.
However, today protections are in place that make participating in a study a very safe experience.
I think that African Americans can take time to educate themselves and others about the clinical trials that exist and the informed consent process.
Also, as part of the research that we're doing with the All of Us campaign, we partner with various healthcare organizations. All of Us Illinois is a conglomeration of the University of Illinois, UI Health, the University of Chicago, Northwestern, North Shore, and those are our partners. Kyla, are you on? I don't see you on my participant list, but you may be on by phone number. Kyla is our representative from Northwestern, and she may not be on today, but I just want everyone to understand before we get a little deeper into what we're going to talk about today, I just want to read this disclaimer so that everybody understands that the views and opinions that we're going to talk about today that will be expressed by our panelists and our presenters do not reflect the views and opinions of the Delta Research and Educational Foundation, that is DREF. DREF Research Matters for All of Us, the National Institute of Health, All of Us Research Program, or any of the organization affiliates. You will see just now placed in your chat is a link tree. As we begin our detailed discussion today, if you click on that link tree, go down to Citywide Coordinator, you can give us your opinion of the presentation today, in addition to any suggestions that you may have. Our speaker for today, in just a moment, you'll hear from Chandra Burton. Chandra Burton is a nurse. She's currently a PhD candidate at Rush. Her dissertation and project is really around spousal caregiving, and she's going to give us some helpful pointers in terms of how we can alleviate both the physical and mental effects that we are seeing as caregivers today. Dr. Burton, or soon to be Dr. Burton, I will turn it over to you.
Well, thank you, Dr. Collins. I want to apologize for not being visible, my camera, for some reason, because I was just on a Zoom meeting yesterday, so I apologize. But we'll get started. We'll keep this party going here. So again, my name is Chandra Burton, and today I will be presenting on the topic of taking care of yourself while caring for others. I chose this topic because self-care is often neglected in our everyday lives. Next slide, please. So there are 4 different kinds of caregivers. So I'm sorry. As a nurse, I'm often reminded that caregiving will be a part of every person's life, whether it's giving or receiving care. So I want to begin this presentation with a quote from former Lady Rosalind Carter. There are 4 kinds of people in the world: those who have been caregivers, those who are caregivers, and those who will be caregivers, and those who will need caregivers. Regardless of our race or ethnicity, caregiving is universal. Next slide. So who are caregivers? A caregiver is any relative, partner, friend, or neighbor who has a significant personal relationship and provides a broad range of assistance for an older person or an adult with chronic, disabling, or serious health condition. Caregivers play a significant role supporting their care recipient, and they are often the main source of valuable information about the care recipient. Next slide. So what else do we know about caregivers? We know that more than 50 million, and I said 50 million, people provide unpaid care for a care recipient, and their numbers are growing. Family caregivers play a vital role, but often lack necessary support. Many caregivers struggle to balance their caregiving responsibilities with their work and taking care of their own health and well-being. In fact, 12 million people report caregiving has negatively impacted their health. That's a lot of people. Next slide. So in addition to what we know already about family caregivers, today's family caregivers are diverse. 17% of caregivers identify as Hispanic, while 14% identify as African American or Black. As Dr. Collins says, more research is needed to understand the similarities and differences of our diverse caregivers to develop the most supportive policies and programs. Evidence shows that caregiving in the African American and Black community is informed by cultural traditions, expectations, and norms. On average, African American and Black caregivers are 47.7 years old, more likely to be female, younger, and sandwiched between caring for more than one person. Additionally, they are more likely to be unmarried, more likely involved in high intensity caregiving, and providing 31.2 hours of care weekly. Next slide. And then you can go to the next slide. Also, more likely than Hispanic whites to care for their care recipient alone and unpaid. They often experience financial consequences from caregiving, such as reduced savings and increased debt. They're more likely than non-Hispanic white caregivers to report being in excellent or very good health. So just like Dr. Collins said earlier, we live in a very diverse society. However, most of the research being conducted is conducted using white participants. So we've had this partial picture for decades. And what that results in is certain drugs and treatments not working as effectively for some people versus others. Currently, diverse communities, especially Black individuals, have higher incidence of diseases such as diabetes, cardiovascular disease, and dementia, just to name a few. We need a complete picture. We need a complete picture to make a difference in health outcomes for Black and Brown communities. So I'm asking today that each of you consider, if you haven't already done so, consider being a part of a study, a research study. This will allow us to learn more about various diseases and conditions. It will help researchers find new ways to prevent diseases. and will also benefit our future generations through scientific advances. So now I want to switch gears and go back to caregiving. And again, for my presentation today, I'm going to take just a broad outlook on caregiving in general. I'm not going to focus in on a disease. Okay, so what are the duties of caregivers? The duties include, on average, a family caregiver will spend 24 hours each week providing care to their caregiver. And most will spend over 40 hours per week caregiving. Some of the tasks include taking care of their significant or family members' finances, advocating for their care recipient, managing medications and medical appointments, managing various equipment such as wheelchairs, hospital beds, ventilators, tube feedings, etc., as well as communicating with doctors and insurance companies, et cetera, because we know there's a lot involved in this. And if you look very, very closely, you see that taking care of self sits right at the bottom of this list. Why is that important? Because while taking care of yourself is one of the most important things you can do as a caregiver, it is often one of the most overlooked items because the caregiver is often consumed with caring for their care recipient as well as other responsibilities. Next slide. Okay, thank you. So what are some of the things that you might see happen in your day if you're not ensuring your self-care? Some of the things that you may see is low energy, a feeling of hopelessness, having less patience for your situation and the people around you, increased headaches, stomach aches, and other physical symptoms of stress, difficulty falling and staying asleep, challenges in eating habits and urges to eat comfort foods, and that includes sweets. For some people, it's salty foods. We often see depression as well as anxiety. And this is huge, especially in the Black community, because often we are taught to, carry our situation, keep everything internalized. But what we need to do is to start talking about our emotions, start talking about what is going on with us. And oftentimes we are faced with difficult conversations, difficult situations. So I want to take a few minutes to talk about some of the difficult conversations that we need to have in our caregiving journeys. And that is including wills and trust. So my first disclaimer is I'm not a lawyer. However, I feel that there's a need to discuss this topic because let's face it, most people don't feel comfortable talking about what will happen when we die. And wills and trusts are essential in making decisions about tangible items that you want to leave for your family. I'm not sure how many people have already started the conversation about this important topic. So starting the conversations is essential. Continuing the conversation is crucial. And we must have open communication throughout this process. So seeking the assistance of an elder lawyer is key. And an elder lawyer is the special, elder law rather, is the specialty of law that focuses in on both the legal needs of senior citizens and their families. Elder law may involve the preparation of wills, financial powers of attorney, medical powers of attorney, living wills, trust, guardianships, elder law. And they can also involve planning for Medicare, Medicaid, probate, veterans benefits, as well as estate planning. I'm not sure, well, on my screen, okay. The National Academy of Elder Law Attorneys has a searchable attorney database accessible to all. And unfortunately, you can't see it on Dr. Collins' slides, but I will make sure that this reference is available. So it's the National Academy of Elder Law Attorneys. And again, I'll provide the website. And this is a website that you can go to and you can search in your area. So for example, if you live in New York, Texas, Georgia, you can search this website and they will assist you, the website. And there's also contact information that you can reach out to individuals and they will assist you in finding an elder lawyer in your area to have these conversations about wills and trust and advance directives. Okay. So I want to move forward and I want to talk about what is self-care. Self-care is the act of taking care of your mental, physical, and emotional well-being. In other words, taking care of yourself in a way that works for you. Because self-care is different for everyone, and everyone has different needs. When your needs are taken care of, the person you care for will benefit as well. Self-care doesn't have to be time-consuming, but does require regular and ongoing consideration. Self-care is important because self-care can improve physical health, reduce stress and anxiety, boost self-esteem, and help manage mental health issues. Self-care takes self-awareness. The only way we can properly um, self-care is if we are aware of enough, if we are aware of ourselves and to understand the action that is needed. So when we talk about setting goals for self-care, one of the most important self-care skills is goal setting. We set goals all the time. So here's an example of a goal you might set for yourself. However, this is a goal that is too broad. So for example, engage in activities that will make you feel more healthy. This goal is very broad. And if we leave it broad, the chances of us achieving the goal the chances of us achieving the goal it probably will not happen. So once a goal has been set, it needs to be decided how exactly you will achieve the goal by making an action plan. So in building a self-care action plan for yourself, I encourage you to start with the SMART goals framework. And using a SMART goal framework, this can contribute to your success in achieving your goal. So your goals should be specific. They should be measurable. They should be achievable. They should be relevant, and they should be time bound. So that's the SMART goal. And if you're embarking on a new self-care plan, I want you to always remember it is a process to go slowly. So for example, if you take small actionable steps, the little steps will count bit by bit. So here's an example of a self-care action plan using the SMART Goal framework. I understand that taking care of yourself is essential to taking care of others efficiently. So I will commit to exercising and eating healthy meals at least 3 times every week. This goal outlines taking care of your health through exercise and diet. It's measurable. This is an ongoing process and goals will be revised. New goals will be developed. You might also want to try finding an accountable partner, somebody who can champion you. Maybe it is a sibling, a best friend, or a therapist, or a coach. Daily practices for caring for yourself. As I shared earlier in this presentation, self-care is different for everyone, and everyone has different needs and things that bring them joy, or at least should bring, or at least used to bring them joy. So please keep in mind that these are just a few suggestions, ideas, and there are many, many more that you can explore. So for example, it is okay to laugh. It is okay to find the humor in a situation. Laughter is good for your soul and your health, and make laughter a daily priority. Consider creating a gratitude list. And this could be as simply as saying, I am grateful for the fact that my neighbor took out my trash. It can just take a few minutes. You can just take time out to write 3 to 5 items down that you're grateful for. Journaling, journaling your thoughts if you feel uncomfortable. Journaling can focus on answering questions. So for example, where are you finding joy? Do you feel like you're getting enough rest, for example? Prioritizing your caregiving goals, as well as completing a word search or a crossword puzzle. On the next slide, I have an example of a caregiver self-care activity worksheet. However, you can easily design and maintain your own caregiving worksheet on a notepad, for example. So it doesn't need to be anything fancy. It doesn't have to just something to allow you to track your self care activities. So for example, some of the questions here, or some of the statements here, would be to identify your favorite songs, for example. Maybe this week you want to highlight jazz. So you want to put that down. If you're exercising, how often are you exercising? Did you exercise once a week? Did you exercise twice a week? Are you working out? Are you running, for example? And one of the key things is incorporating a reflection. So when you exercise, how did that make you feel? Maintaining your own health and well-being is crucial. Hydration is important. Keeping track of your water intake, for example. You can use your phone, you can download an app, or track it the old-fashioned way by writing it down. I know everyone is not a fan of water. Um, I suggest you make fruit ice cubes, or add fruit and vegetables, or add calorie-free flavoring to your water. Also consider keeping a food journal for you and your loved one, making time to schedule annual checkups. And if you're not already, consider monitoring your blood pressure, your weight, sleep pattern, and activity, and taking these items with you to those appointments for discussion. Next slide, please. As the saying goes, we all have to go, and some days we go more than others. So consider developing a 5-minute bathroom exercise routine that works for you. While brushing your teeth, you can do some squats and lunges. You can also march in place. You can use the sink or counter and do some push-ups and some tricep dips. You may also want to consider meditation, deep breathing, and stretching exercises for better flexibility. So take time for you, invest in self-care, monitor your own health, ask for help, and accepting help is challenging. There are a lot of emotions that one has to grapple with. So so for example, when it comes to trying to figure out what can someone else do for you, I asked you to consider making a list, tracking that particular, list. So here we have tasks such as meal planning. So you can track this just to highlight. I'm sorry, my screen just went blank.
If it helps, it's the slide that looks like various folks that have volunteered to help you with meal planning and how you contact them.
Yeah, my screen just went blank. I thank you. I ask that you consider asking for help. So when asking family members, such as your siblings, for help, if possible, I know it isn't easy, but when asking for help, try not to start with you. So such as you never, fill in the blank, you always, why don't you, for example. Instead, start with the word I. I need a break. I need a break so I can go to the doctors. I need a break to care for some personal concerns. I would love to take a break, but find myself afraid to leave. Do you have any suggestions? These are questions or responses for getting assistance and not starting an argument or debate with your sibling or the person that you identify that may be able to help you. For example, keeping with the trend of I'm wondering if you would like to sit with, so for example, mother, mom, dad, each day for an hour or so, whatever works for you. I'm exhausted and really need a break. Can you help me or find someone to help? So consider making a list of tasks that identify individuals that you're okay completing those particular items. And it's okay to revise this list and remove or add people, as needed. And lastly, stay connected. If you're not already, consider joining a support group. And I know a lot of people feel, or may even have the perceived ideas that, a support group is not for me. And I'll be honest, you may not be able to go just to the first support group and have a Jerry Maguire moment and be able to say that this one in particular support group completes me. That happens for a rare few people. But in reality, what it takes is identifying a support group, going to that in support group and continue to, try out support groups and also variations of the support group. Unfortunately, due to COVID, we have more options, such as remote support groups, and we still have the in-person support groups. I know some caregivers that they belong to different support groups because they feel as though the various support groups give them, certain things. So for example, this support group may be more intimate because it's a smaller number of people that belong to this support group. So they feel as though they can really go in there and just be their authentic selves. This support group over here may be larger, but it's connected with a hospital or it's connected with a clinic. So this particular support group, provides this individual with resources, through going to the support group and talking to the support group members, they were given the information about a formal, support service option, for example, a day center. And so that gave them the chance to ask these other support group members about the service that they received, to more or less calm down their nerves for 2 or 3 or 4 other people to say, yes, I've been using this particular, formal support, this day center for the last 2 years. I feel very comfortable with this support group or this adult, day center. And this way you learn more information. You can also come back and you can share, things that you tried out. For example, I had a caregiver. I'm a support group facilitator, and I had a caregiver who decided that they needed a break. They needed a vacation. So they were able to find a respite facility. And, unfortunately, this particular facility didn't work for them, but that allowed them the opportunity to, find another one, which that particular facility worked out very well for them. They were able to go on their 3-day, vacation. They felt very comfortable, leaving their spouse at this facility. And last thing I want to say, because my screen is again is blank. Self-care is not an expense, it is an investment. So therefore, I would like for everyone just to continue to find ways to find time. Again, if you have not joined a support group, to consider joining a support group. There should be a screen that has just various individuals, and then followed by that particular screen, there is various slides with resources. So one of the resources on there is the Family Caregivers Alliance, the Illinois Resource Network, and I have the website there. And the Illinois Cognitive Resource Network is a website that was created particularly for the state of Illinois, the residents of Chicago and Illinois, and it provides videos, it provides definitions of terms, it provides information about local facilities such as adult daycare centers, formal support services, and where you can find them in the Illinois area. On the next page, there should be additional resources such as the area agents on aging. On one of the pages, there should be caregiving conferences and training opportunities. Every year, this organization is called Caregivers Count, and it is specifically for caregivers. This upcoming fall in 2024, they are hosting their annual conference. It'll be the 14th year of the conference, and it is hosted virtually. It's normally hosted over 3 or 4 days. Individuals that sign up, you will receive reminder, notifications that it's up and coming, as well as, unfortunately, if you're not able to attend the sessions that you may decide to sign up for, they will provide videos or the recording at a later date. There should also be a resource for what's called the caring for people with memory loss. And there's a website that I provided there. And this particular conference is going to be coming up in June. It is hosted by the University of Minnesota. And it's a conference that will provide resources for individuals with memory loss. And then the last one on the list is called the Caregiver University. And this is through the University of Mississippi. And this is a course. It's hosted virtually. It's a 2-week course, and you have to register for it. It's going to be hosted in I think, late summer and in the fall. And what it provides is just interactive training sessions for individuals that have recently become a caregiver. And so it goes into detail, in particular with dementia, and it goes into much detail about behaviors, what to do when working with individuals as they go through the various stages of dementia, medication management, for example. Not everyone, of course, is a nurse, but we as caregivers may find ourselves assisting our care recipient with their medication. So it goes over those particular items, and again, it's a 2-week session. So again, these were just some of the resources that I added to the slides.
Thank you, Chandra, so much. We do apologize for the technical difficulties but I think you got through those fine. I'm going to take a moment for, I've been sent some questions for people to put questions in the chat should they have any. Chandra, I'll give you a moment to post also some of your links in the chat. I just really want to make sure that everyone understands that really we can all make a difference. This campaign is really an opportunity for everyone to learn about their risk of disease, really to figure out how different treatments work in different populations and backgrounds, really to identify which facility and what kind of providers connect best with you. And if there are technologies that are needed, technologies that can help us move closer to being healthier. Again, should you be interested in joining the campaign, you can go to joinallofus.org and click join now. It's very simple. You set up a password and the facility that is closest to you will reach out. How you participate, this graphic shows you. Really, at this point, 18 and above, there are a series of enrollment opportunities online and consents that you sign. You answer an array of questions about lifestyle, about healthcare, about your family history, personal history, where you live. There are physical measurements, and then there are biosamples, blood or saliva and urine. And then if you wear any kind of wearable device, Fitbit, Apple Watch, the Google Watch. All of those also can be attached to your record, so there's real-time data available. What very commonly is asked is what is the security of your data? All of your data is secure. It is all kept in one location. For those providers that decide they want to use this, they go through a very rigorous course to ensure that they understand what participation means. And should they begin to use that data, it's all de-identified. That means they never know Yvonne Collins is a 53-year-old woman from Chicago. And so that's very important. What information is shared back to you? Because we hear that very commonly. Researchers very commonly come into communities, get information, but the community never learns about that information. So all of your information, it is yours, you own it. Ancestry information comes back to you, traits come back to you. If you are at risk for any kind of particular diseases or health conditions, that will come back to you. How your body might react to various medications, that comes back to you. In addition to a genetic profile, as more genes are identified, we learn who is at risk. Last year, we learned of a gene that was prevalent in the African American community that put you at risk for chronic kidney disease needing dialysis. Wouldn't you want to know that ahead of time? So all of that information that's gathered comes right back to you within your portal, and you're able to see it and use it however you see fit. Very pleased to say that, again, the goal is 1 million. We have consented almost 780,000 participants, 62,000 of those which are in Illinois. When all the things that I went through in terms of consents and surveys and your in-person appointments, about 535,000 participants have completed those, almost 50,000 here in Illinois. But what we're most proud about is when you look at underrepresented minorities that have participated in research historically have not been included, 87% of the population of those that are participating are from those backgrounds, which is fantastic. We're always looking at and identifying researchers, especially researchers of color, to really take the data and look at it. We've had 731 of those who've registered in terms of institutions, almost 10,000 researchers, and basically 9,000 workspaces that have been created. That is sort of separations of data for folks to begin to look at it and research it. And so our healthcare partners really work with us in this role. Again, these are our participants here in all of us, Illinois, and they work with us to ensure that all of the things that have to happen in person, all of the in-person activities, enrollment activities, and community events, they take a part in and participate with us on very closely. As I said earlier, when you enroll, there's an online portion. I won't read all of this, but you go through all of that consent process. You agree to have your data put into the database. And then as new surveys come out, you're also allowed to participate in those. For example, we recently had an exercise and nutrition program come out. And so for those that are in the database, you're automatically informed of when those new studies are made available. And then all of your biomeasurements are done in person. There's compensation for those. There's parking provided. If you don't have a car, there are either bus carts or Uber and Lyft services provided. So it really has been really intentional at getting past some of those things that we've seen as barriers. So hopefully you have learned today, first of all, who DREP is, what the All of Us program is, and but more importantly, the importance of research in every realm of what we do each and every day, with our focus today being on caregiving. Again, please feel free to scan that QR code. It's also in the chat. Give us your opinion of what you thought about today. Again, feel free to go to joinallofus.org/DREF to get more information on the program and to enroll. If you have any events that that are coming up that you would like for us to participate in, feel free to reach out to me. That concludes our program, and we're going to go into question and answers. But we will have an in-person, actually 2 in-person programs next Saturday. What we know is that 1 in every 3 Americans are at risk for kidney disease. We are having a free kidney disease and diabetes screening event next week at Kingdom Baptist Church, which is at 301 North Central, right on the west side of Chicago. Again, you must be 18 and older to participate. You can either scan the code and register and pre-register today. Walk-ins are available, but what we know about silent killers in terms of kidney disease and diabetes is astounding, and we want to make sure that our communities are informed and empowered. So again, thank you very much for joining us. I'm going to stop sharing, and I'm going to start with the questions for Chandra that have come in directly to me. Chandra, can you talk a little bit about, you talked about asking for help. Do you have resources, recommendations for those that really have no other support? Their family perhaps is not willing to help. Are there other resources that you know about that can potentially provide help for them, either in the home or with the person that they're providing care for?
Yeah, there are resources out there, and depending on where they're at in the United States, there are resources through different organizations that will come out and provide assistance. But I would highly suggest that the individuals seek support from an informal support group. And I'll send Dr. Collins. I do have a couple of support groups that I could recommend out there, and they're hosted virtually. And I feel like these support groups would be very helpful, because they would also be able to provide, additional resources.
Okay.
And
Thank you.
asking your also assistance, does this individual, it's just that they don't have any support from their family currently?
It sounds like they, besides support groups, they don't have any support at home. Like you talked about the importance of respite. And you talked about the importance of folks perhaps giving you a breather. It sounds as if they don't have an opportunity for breathing, and really trying to be intentional about looking at what their other options are in terms of resources.
Okay. Because it would be helpful too to know where they're at in the United States. But
They're in Chicago.
They're in Chicago. Okay.
Mm-hmm. Yeah. So if you have some of those, we can gladly ensure that those are sent out to the group.
Yes, I can send out some. Okay.
The other thing that someone asked about, you talked about prioritizing goals. How do you begin to identify, with all the needs you have to provide for the person that you're caring for, how other things fit in terms of priority? And that's a really hard question. I do understand.
Yes, that is a very hard, difficult question. And again, it does go back to support from your family, your friends, but just taking it on just a very simple, everyday, I have all these errands, have,
My name is George.
hi, George, is this your question?
I think George may have been off of mute because everybody
Okay,
went back on mute. It may
okay,
have been, it came anonymously.
yes, yes. Okay, so going back just to everyday tasks, sometimes, well, not sometimes, all the time, it's easy to become overwhelmed because if we leave things in our mind, just floating around, it's so much. But sometimes just writing it down and writing down everything that we need to do in that particular day, such as maybe it's going to the grocery store, maybe it's washing clothes, and just trying to be very, general, just everyday things. But when we add it up, there's 10 items. And it's still, we know there's only 24 hours in a day. So sometimes it's very helpful just to get out a piece of paper and write those items down, and let's prioritize it. What really is something that really needs to be taken care of today. And then let's go down the list. Today may not be the day that all the clothes are going to get washed. It's just certain items are going to get washed. These are the key things that I need to do today. But going on a bigger level, that's when the support of other individuals through various organizations is very helpful.
Thank you. Thanks, Tanya. Tanya put in the chat that she keeps a notebook with daily to-do items. And sometimes, absolutely, you can't remember all of those things. So, the old adage of writing it down and checking it off could be very helpful for some folks. The last
Yeah.
question I have before, if anybody has a question, they want to put it in the chat or raise their hand. The other thing that came up is you talked about on a slide the number of folks that are totally unpaid and uncompensated for the care they provide. Are you able to, and I know that's a whole nother lecture in and of itself, but able to talk about opportunities where there could be pay for caregiving?
Yeah, every state through Medicare, Medicaid, they have options. So this is something, each state. So this is through the area on aging, the 3As. This would be a place that we could start, to investigate. But this is one that a lot of people are not, familiar with, but there are places and resources that you can obtain information about becoming a paid caregiver. There's also training as well that individual can go through.
Thank you for that. That was the last official question that came in. If anybody wants to come off of mute and raise their hand and ask a question, we absolutely can do that. But hopefully from the resources and the lecture, you've gained just some additional information about how you, as a caregiver, can begin to really think about how you care for yourself and the importance of caring for yourself. Because what very commonly happens is while you're taking care of someone else, your health, both physically and mentally, are dwindling. And then you can't be the best person, not only for the person that you're caring for, but really the best person for yourself that you need to be. So I want everybody to also remember that. Peyton, I see you're on. Do you want to bring any words from the DREF office?
No, I actually don't have anything to bring. That was a really great event. And thank you everybody for attending, and
Yeah.
go to joinallofus.org/DREF to learn more. That's all I have.
Thank you. Thank you all for joining. If there are no
Yeah.
other questions,
Woo-hoo.
everyone have a great afternoon. Please, if you're free and local, join us next week at our kidney events. And again, thank you all very much. I will, if you're interested, leave your emails if I don't have them in the chat. I will forward further future events. And also I
Oh,
will
shoot.
YouTube channel, Drug Chicago, the recording of this session once it's completed. Thank you very much. Thank you, Chandra, for an excellent presentation, despite all of the technical challenges. And thank you all so much for joining us today. And have a great rest of your afternoon. And happy Palm Sunday.